I remember the day I finally decided something had to change in how I talked to my doctor. I was 84, sitting in a small exam room that smelled faintly of disinfectant and hand sanitizer. My back was stiff from the hard plastic chair, and I could hear my heart pounding in my ears. Looking at the medical diplomas on the wall, I wondered, why do I always feel so small and helpless in front of this person who's supposed to be helping me? I'd spent my entire life believing doctors knew best, and that I had to just nod politely, listen, and follow instructions without question. Yet here I was, frustrated, confused, and feeling like a bystander in my own healthcare decisions. It's not that my doctor was unkind. She was actually quite pleasant, with a gentle smile and an impressive track record. But every appointment was rushed. I'd barely managed to mention one symptom before she jumped to another, scribbling notes on a chart. I'd walk out with a prescription in hand, but no real clarity on why I needed it or how to take control of my own health. After one too many sleepless nights of worry, my knees aching, my blood pressure spiking, I finally realized I had to speak up. And that one conversation changed everything. These days, too many of us over 65 find ourselves in this predicament. Our bodies shift, our health concerns multiply, and suddenly we feel like we're drowning in medical jargon. We're often treated like we can't understand the details, so doctors condense everything into quick bullet points that we can't fully digest. Here's the problem. When you don't feel in charge of your own health, you risk losing not just your physical well-being, but also your independence. You might miss out on activities you love, like gardening, traveling, or even just spending quality time with family, because there's a nagging health concern you never properly addressed. And if you let these issues build up over time, you could face far more serious complications, extended hospital stays, more medications than you can keep track of, or even the frightening possibility of losing your autonomy entirely. What I'm about to share is the culmination of years of questioning, observing, and talking to folks well into their 80s and 90s who have managed to maintain a remarkable sense of independence. In this video, I'm going to walk you through 5 practical insights that will help you take charge of your medical conversations, rethink misconceptions you might hold about dealing with doctors, and reclaim your autonomy. You'll learn how to challenge outdated advice, spot the hidden pitfalls in well-meaning but incomplete recommendations, and tap into your inner confidence. And make sure you stick around for the 5th point, because that final step, one that hardly anyone ever discusses, is the key that often unlocks a new level of freedom and understanding in your twilight years. After decades of studying seniors who live beyond 90 with energy and enthusiasm, forward-thinking specialists are finally recognizing the power of patient-driven medical care. It's no longer about handing over your body to a professional. It's about collaborating as equal partners. If you want more content like this, please subscribe and turn on notifications so you don't miss any new videos. And if at any point you find this information resonates with you, type 1 in the comments to show your support. If not, type 0 so I can continue to improve and give you the best possible guidance. Let's dive right in. The first major shift I made, one that truly rocked the boat, was to stop blindly trusting every piece of advice I was given. It sounds almost heretical, doesn't it? After all, aren't we raised to respect medical professionals and assume they know what's best? Yet here's the controversial statement that changed my life. Not every recommendation from your doctor is tailored for you. Many times doctors rely on general guidelines that might fit the average patient, but don't necessarily apply to your unique situation. And that's a problem for seniors who have individual health histories, different tolerances, and personal lifestyle considerations. The common misconception most people believe is that if a doctor prescribes a medication or suggests a procedure, it must be absolutely necessary. But let me share the story of Harold, age 79. He was prescribed a high-strength pain medication for a persistent backache. Harold, wanting to be a good patient, took the pills exactly as directed, never questioning the dosage or even considering alternatives. Within a month, Harold found himself dealing with unpleasant side effects. His appetite vanished, he felt dizzy whenever he stood up, and worse yet, his mind felt foggy. When he finally got a second opinion, Harold discovered that a lower-strength medication combined with simple core-strengthening exercises, was enough to relieve his back pain. He'd been over-medicated for weeks, and the real culprit was a simple misalignment in how he was walking and sitting each day. Here's the surprising insight. Doctors aren't mind readers. They don't know what you don't tell them, and they often err on the side of aggressive treatment because most patients say very little during appointments. And if you assume every treatment path is perfect for you, you might wind up with unnecessary side effects or even risk your independence if those treatments interfere with your day-to-day life. The practical step here is to get comfortable saying, could we try something different first? Or is this the lowest effective dose? Challenge the one-size-fits-all approach. Ask specific questions about how a medication or procedure will impact your ability to remain active. Make sure the focus is on preserving your daily functioning, not just masking symptoms. When you embrace this mindset, the emotional benefit is profound. You start feeling more in control of your body, more confident in expressing your needs. Instead of simply enduring whatever comes your way, you direct your health plan toward what truly matters. Living independently, staying socially active, and enjoying each day to the fullest. It's like removing a blindfold. You see that there are options, and not all of them require heavy pharmaceuticals or invasive procedures to keep you healthy. Now let's move to the second point, which might hit even closer to home. One of the biggest misunderstandings we have is believing that technology is for the younger generation and that seniors should shy away from it. I'm here to tell you that's absolutely untrue. The bold statement is this: embracing technology can significantly improve how you manage your health and talk to your doctor, even if you're 85 or older. We're often sold on the myth that seniors can't learn new technology because it's too complicated or because our brains somehow stop working as we age. That's simply not accurate. Consider Martha, who is 82. She had never touched a smartphone in her life. She always used a flip phone for calls and a radio for music. But when she began experiencing frequent headaches, she took the leap. She got a simple tablet device to track her blood pressure readings. With a few easy lessons from her grandson, she learned to log her readings daily and share them through an online portal with her doctor. In less than 2 weeks, Martha's doctor spotted an alarming pattern. Her blood pressure spiked every evening after dinner. Together, they discovered it was triggered by a particular medication she was taking too close to bedtime. The fix was shockingly simple. She switched to taking it in the morning, and her headaches largely disappeared. No new prescriptions, no complicated treatments, just better information flow between patient and doctor. This leads to the surprising insight. If you're willing to adapt, technology can become your ally, not your enemy. You can use it to schedule appointments, request prescription refills, and even send messages directly to your healthcare provider. It helps you keep track of your vitals, your diet, and even your exercise routine, giving you a real-time snapshot of your health. The practical advice here is to start small. Maybe you're not ready for a wearable fitness tracker or a smartwatch. That's fine. Use a simple blood pressure cuff at home, record the readings on a piece of paper or a phone app, and bring that data with you to your doctor's office. Or try a medication reminder app that pings you when it's time for your next dose. Emotionally, you'll feel a sense of empowerment as you take tangible steps to monitor your own well-being. You transform from a passive recipient of care into an active partner who brings valuable information to each appointment. And that independence is exactly what fuels a more dignified, fulfilling life at any age. If you're still watching and this makes sense to you, type 2 in the comments below to let me know you're here and finding this valuable. Remember to subscribe if you haven't already, so you can stay updated with more tips on living your best life after 65. Let's keep going. Moving on to the third point, which is something I wish I'd learned decades ago. Your intuition is more powerful than you think. Here's the bold statement. If your gut says something's off with your health, even if all the lab tests look normal, you have the right and the responsibility to push for answers. Too often we rely solely on test results, which can be incomplete or misleading. Tests don't measure every nuance of how you feel, how you move, or how your body reacts to subtle changes in your environment. Most seniors believe the misconception that if labs are fine and the doctor says, You're just getting older, then there's nothing to be done. But let me introduce you to Doris, who's 76. She lived with persistent fatigue for nearly a year. Her doctor ran blood tests, scans, and everything looked normal. Still, Doris knew deep down that feeling this exhausted wasn't just part of aging. She could remember how spry she felt at 70, and she sensed something more was going on. Finally, she insisted on seeing another specialist who discovered a slow-building thyroid imbalance. One small adjustment to her medication, and Doris was back to her walking group at the park within weeks. She credits her recovery to trusting that persistent voice in her head that said, "This isn't normal for me. Keep asking questions." The surprising truth here is that lab work and imaging scans offer a snapshot, but they don't capture everything about the human body. And a doctor might be so used to seeing severe cases or textbook symptoms that anything less obvious simply gets brushed off. Your lived experience matters. The practical step? Document your symptoms in a daily journal. Track how you feel upon waking, after meals, or before bed. Notice patterns in your mood, your energy levels, or any discomfort. Bring these notes to your appointment and share them. This not only helps your doctor see beyond a single lab result, it also shows that you're serious about uncovering the root cause. Emotionally, following your intuition fosters a deep sense of self-trust. You're no longer afraid to say, "Wait a minute, doctor, I know my body best." And that's the real power shift. Instead of walking away from appointments feeling unsure or dismissed, you walk away feeling validated and armed with more information to preserve your autonomy. It's the difference between living as a passive patient and thriving as an active advocate for your own body. Up next is the fourth point, something many of us hesitate to talk about: the power of setting boundaries with your medical team. The bold statement? You can and should say no sometimes, even to a physician's recommendation. The misconception is that doctors always welcome questions or even gentle pushback, but the reality is that many are pressed for time and may inadvertently steamroll your concerns if you don't assert yourself. Look at Robert, age 87, who discovered this the hard way. He had been told to schedule several follow-up tests for a mild heart flutter. Robert wasn't opposed to tests themselves, but the frequency, every 2 weeks, felt excessive. Each test meant stress, inconvenience, and co-pays that started adding up. After months of going back and forth, Robert mustered the courage to say, "Let's talk about why these tests are necessary. Is there a possibility we can space them out or reduce how many I need?" His doctor was initially taken aback. Yet when Robert explained the toll these visits were taking on his everyday life, the doctor agreed to a more reasonable schedule, every 2 months. And guess what? Robert's heart health remained stable, and he kept his sanity. The surprising insight is that many healthcare professionals are open to negotiation when you communicate your concerns clearly. They just might not volunteer that flexibility from the start. The practical advice is to practice what I call the three-question rule. Whenever you receive a recommendation you're not sure about, ask, what are the pros and cons of this approach? What are the alternative options? And how will this impact my daily life? If the answers don't sit well with you, say so. Propose an alternative if you have one, or ask the doctor for a modified plan. Emotionally, setting boundaries feels like reclaiming a part of yourself that might have been suppressed for years. Instead of being anxious or resentful about endless medical interventions, you gain peace of mind by knowing you have a voice. You realize that independence doesn't just mean living alone or driving your own car. It means actively shaping your medical journey so it aligns with your values. If you've made it this far and are still finding value, type 4 in the comments to let me know you're here. And if you haven't subscribed yet, consider doing so now. Your support helps me continue bringing you insights to enhance your independence. Finally, the fifth insight, the one that genuinely transformed my own relationship with my doctor and boosted my autonomy, is this: shift the conversation to your personal goals rather than focusing solely on your ailments. This might sound odd, but it's incredibly impactful. The bold statement is that health is not about merely avoiding disease. It's about preserving the freedom to live life on your terms. So many seniors fixate on managing a list of conditions diabetes, arthritis, high blood pressure, without ever connecting these management strategies to their personal aspirations. A common misconception is that at our age, we should just be grateful for each day. While gratitude is wonderful, it doesn't mean you shouldn't aim higher. Let's talk about Evelyn, age 85, who loved knitting. Arthritis in her hands began to hamper her ability to knit, which broke her heart because it was how she relaxed and connected with her grandchildren. During one appointment, she decided to approach her doctor differently. Instead of saying, "My hands hurt," she said, "I want to continue knitting without intense pain for at least 2 hours a day." That simple shift changed the tone of the entire visit. Suddenly, the conversation became about Evelyn's passion and life goals, not just a symptom to be minimized. Her doctor recommended a regimen of specific hand exercises, short breaks every 30 minutes to reduce stiffness, and a mild anti-inflammatory medication only when absolutely necessary. The focus was on enabling Evelyn to keep doing what she loved, rather than simply fighting arthritis as a disease. The surprising twist is that doctors often find it easier to design care plans when they understand what you want to achieve in your daily life. It's a more motivating conversation for both parties. And the practical step is to head into each appointment with a clear goal in mind. Whether it's walking a mile, playing with your dog, or traveling to see your grandchild's graduation. Frame your health discussion around those meaningful activities. Ask your doctor, "How can we make sure I can keep doing this?" Or, "What's the plan to help me maintain this hobby or travel schedule?" That's how you ensure you're on track to preserve your independence. Emotionally, the benefit is tremendous. By focusing on life goals, you regain a sense of purpose beyond just checking off your medication list. You transform health appointments from dreary sessions about what's going wrong to proactive discussions about how to keep your life vibrant. And that mindset isn't just freeing, it's profoundly uplifting. You remember that even in your 80s or 90s, your dreams, hobbies, and passions matter. It's a declaration that you're not done living. Far from it. That was the major realization I had in that conversation with my doctor at 84. Instead of giving her a rundown of everything that hurt or wasn't working, I told her I wanted to stay active enough to attend my granddaughter's wedding in a different state and dance at the reception. Suddenly, our dialogue wasn't just about prescribing pills. It was about brainstorming how to achieve that goal. It brought us closer, fostering mutual respect. And from that day forward, I felt empowered to question, adapt, and shape my healthcare experience. Now, as we wrap up, take a moment to reflect on these 5 points. First, don't assume every recommendation is tailor-made for you. Ask if there's a better option. Second, leverage technology, even in small ways, to manage and share your health information. Third, trust your intuition and push for answers when something feels off. Fourth, set boundaries by asking for alternatives and negotiating your care plan. Fifth, center your healthcare discussions on your personal goals rather than just your ailments. When you weave these 5 insights together, you create a holistic approach that safeguards not only your physical health, but also your sense of autonomy and dignity. Time is precious and we're never too old to make changes. The sooner you implement these practices, the faster you'll see improvements in how you feel and live. Imagine waking up a month from now feeling more in control, more knowledgeable about your body, and more capable of steering your doctor visits in a direction that genuinely serves you. Picture yourself talking with confidence during your appointments, receiving real answers, and walking away with a plan that truly supports your independence. Whether that's gardening pain-free, traveling comfortably, or simply enjoying a hearty laugh with your grandkids without worrying about your next medication dose. Which of these 5 insights resonated with you the most? I encourage you to think about how you can apply it to your life starting today. Maybe you'll begin by journaling your symptoms for the next 2 weeks, or maybe you'll finally sign up for that easy-to-use health app your neighbor's been raving about. Take even just one step, because real change often starts with a single, simple action. We'd love to hear from you, so leave a comment below sharing one thing you learned or plan to implement. Your stories and insights help build a community where we lift each other up. And if you found this video helpful, please like, subscribe, and share it with someone you care about. Let's help more people recognize that it's never too late to speak up, ask questions, and chart your own path. Thank you for watching, and I look forward to hearing about your success stories in the comments. Remember, your power to shape your future doesn't vanish with age. In fact, it can grow stronger, especially when you're armed with knowledge, intuition, and the courage to have that conversation that changes everything.